it's a sport learning. We just go with the flow, right? I ask you a question, then you answer it. If somebody have a polycythemia vera, like maybe 45-year-old male with a polycythemia vera, and you're going to educate this patient. So the patient is in a hospital, and you get to institute some care. So you are the nurse. You have 4 options. Okay, figure out the concept, and then you check the boxes. So what do you guys think? I'm not seeing any answers yet. What will be your answer? Hydration is the indicated. Iron infusion, phlebotomy, aspirin, and a bed rest. What do you want to do? So, like I said, you have to, when you're doing your learning, I want you to start doing, this is a strategy to master next generation, to recollect after you've studied, draw a table, put the key fact, I'll put the buzzwords there to show you which one you should focus on and which one you call sports learning. These are data and class rates for quick review of what you learned. In polycythemia vera, I'll give you the answer. The problem is the polycythemia vera, the hematocrit is very high, okay? It can go to like 50, 55%. It can go to 65%. It's not good. So the hemoglobin is also high. The RBC is too high. Because of that, they're going to clot. And so we got to take care of that, right? So the problem is hydration will make the blood a little bit less viscous. So hydration is indicated. They already have too much red cells. Why do they need iron? They don't need iron, right? So this is not indicated. Phlebotomy is the way of drawing blood. I call it vampire. You got to vampirize them, take their blood. They have to have frequent blood draw. They come to the hospital and we remove some blood from them. You cannot make the hematocrit normal, but you got to do phlebotomy to help with the loss of the hemoglobin. That can decrease it. I know everybody will run away from aspirin. This is the content. You have to know this kind of thing. So, like I said, if you need help, check adapt in class. I have a video on polycythemia vera. Because the blood is too viscous, think about it, it's going to clot, antiplatelet. So they need antiplatelet to prevent thrombosis formation. This is a very good concept to understand. Polycythemia vera people, they need antiplatelet. So low dose aspirin is good for them. And based on that idea, you should not let them be in bed rest. Otherwise, they form clot. So bed rest is not indicated. So this is the way the picture will look like. I've literally given you everything about polycythemia vera with this simple question. So if you go and take the test and you see that, trust me, you see all this information about hydration, about teaching them avoiding iron, about doing weekly, multiple 2-3 times a week for phlebotomy, about giving them an antiplatelet to prevent thrombosis and let them ambulate, not stay in bed. So this is first questions for you. What do you want to? So you have a patient came in, she's 35-year-old female. The nurse thought she had rheumatoid arthritis versus osteoarthritis. The nurse does not know, right? You say, well, what would she do to figure out based on physical exams or what is indicated based on the order, right? So we have this same thing. What do you see? What do you think is indicated? What do you see? You figure it out. You can see that it has so much content in it. The key is this is the immunomodulator, methotrexate. You can use for autoimmune diseases. So which one is autoimmune? Rheumatoid. Osteoarthritis is non-rheumatoid. Which one involve large joints? Osteoarthritis. Rheumatoid is usually small joints. If you have rheumatoid arthritis, both hands will be affected. Think about it. Older patients, when their knee is hurting, they have osteoarthritis, we always talk about one joint. So asymmetrical is that one. And so small joints, rheumatoid. The key for rheumatoid is morning stiffness. Sometimes osteoarthritis people will have it, but rheumatoid usually the most common people who have morning stiffness. I've given you everything about rheumatoid and osteoarthritis. You see, sport learning on the go. 25 years old, male. Let me see what I'll take you. Maybe let's go to another hematology. Yeah, 25 years old. He's in a hospital. There's another patient, 35-year-old female in the hospital. The nurse is caring for both of them. How would I, and the nurse receive orders, certain orders. How would she know which one should be associated with one specific? So let's see. Avoid contact spots. We need hydroxyurea. It requires you to think, know the disease process, how to treat them, what teaching you need to do. So I'm giving you everything about that disease process, teaching and everything you need to do. As you can see, hemophilia A is a what? It's a bleeding problem. They should not take NSAIDs, right? Sickle cell should be able to take this, and so it's fine. They should avoid NSAID. It's a bleeding problem already. You shouldn't be taking it. Sickle cell people, it's a vaso occlusive disease. So hydration is better for them, right? We should avoid contact sports. Hemophilia A, because when they bump themselves, they're going to bleed a lot. Sickle cell does not, it's not a bleeding problem. It's a vaso-occlusive problem. Hydroxyurea is good for sickle cell patients to improve their hemoglobin function, right? And sickle cell patients to avoid high altitude. I'm trying to give you content that I don't have to lecture you, long lecture, but short lecture with a bunch of facts. This video, if you take it and you see a question, trust me, it will be something related to all these things, what you do, management and teaching. It's called on-the-go learning, sport learning, adapt and place way. So I'm just going to give you an easy one. That one everybody know. 35-year-old female. It's in the OB clinic. And she thinks, says, I am pregnant. Okay, I am pregnant. Well, the nurse is teaching a new graduate and they said, hey, we got to figure out if this patient is pregnant. So she draw a table, put a bunch of numbers here to the new graduate to tell, hey, these are positive signs, these are not positive signs. So fetal atom and ultrasound are all positive. As you guys see, 1, 3 are presumptive. Somebody said 1, 3 are presumptive. Because that's the mother telling you that. And therefore, pregnancy test is probable. It may be, there's so many things that will show ACG, certain things can increase it. So you are not 100% sure, right? And the child weight is done by the doctor. So that's your table right there. I want you to know this code. Okay, know it code. Let's go to mental health. Okay, you have a 35-year-old male. He's on this medication. He has nausea. And so they gave him on that citron and also gave him metoclopramide. Metoclopramide, right? 6 hours later, what is it? He has involuntary movement of the mouth, the lip smacking. I say, what is your diagnosis? So the diagnosis, I put achythesia. I put dystonia, acute dystonia. I put tardive dyskinesia. I put stroke. What is your diagnosis? And then I say, what would you do? Treatment. I put treatment here. I said, well, what are you going to do? IV fluid, or maybe intubate, get a CT of the head, IV fluid, and bench stroking. And I say, here I put, what are you going to observe? What are you going to monitor? What are you going to monitor for? Slurred speech. Slurred speech. And then cortical nurses. And then I put diarrhea, and QT prolongation. What do you think? Client is on dancitron, metoclopramide. All of a sudden, involuntary movement of the mouth, lips is smacking. We have a problem, right? This bow tie. This is the way they say bow tie. They take the concept, then they make stuff up. And what do you see? What do you monitor? What do you see? I just make the question up. First, you got to make a diagnosis. So these are antiemetics. They have they are all central acting. That means they affect your brain, and they have antipsychotic effect. When I see them as antipsychotic medication. And so they have antipsychotic effect by causing extrapyramidal side effect. So they causes extrapyramidal. So this patient is showing it's part of the extrapyramidal side effect, which is I call it the ADAPT, where the A is acute dystonia, achythesia, Parkinsonism, and tardive dyskinesia. Lip smacking is classic for tardive dyskinesia. Achythesia, I will tell you, they have like inner feeling, restlessness. Dystonia, basically, and muscle contraction mostly. It's a severe muscle contraction, but they don't have too much lip smacking. Of course, this patient is not having stroke. What you do, you just have to hydrate. You don't need to intubate. You didn't need HCT. Therefore, you left with this IV fluid and bench stroking. Or you can give them diazepam or anticholinergic, diphenhydramine. We take care of it. They're going to have lip smacking. All the muscle of the body is going to be affected. So you should worry about slurred speech. It tells you they're having dysphagia, airway problem. Okay, they're going to have tuberculosis, but this one is more dangerous. A Down syndrome um, has a QT prolongation effect, and so that may be. Metoclopramide may also be doing it. Then they may be giving the individual diarrhea. Right? If the client is on two medication, that can cause the problem. But I'll pick QT prolongation and slurred speech, which is the QT is from the Down syndrome. Both of them are causing the TD, tardive dyskinesia. You shouldn't combine them together. But based on what I've given you, slurred speech and QT prolongation is dangerous. Okay? Like I said, sport learning, adapt and class way. Maybe one more, then I'll let you guys go and have a good day. Okay? Um, let's do some pharmacology. So which medications, the side effect or this is associated with them based on what I've given you. I see somebody said avoid banana. Somebody said this one. What else? How about small red spot on the chest? Facial flushing, leg edema, hypokalemia, angioedema. He said 2 and 4 is furosemide. Somebody said 2 and 5. Said furosemide, avoid hypokalemia. I guess 1, 2, 3, 4. I guess that's 5 here. Furosemide, hypokalemia. Furosemide, red spot. Facial flushing and leg edema from the Philippines. And the angioedema, it's lisinopril. So you guys got it. So lisinopril, side effect, angioedema, cough, electrolyte problem, hyperkalemia, and teratogenic. So angioedema, you should avoid banana because banana increasing your K. Furosemide is a sulfur drug, and so it can cause red spot, okay, in the face, and then it causes hypokalemia. Calcium channel blocker causes vasodilation, so leg edema and facial flushing. So that's what you see in that condition. Classic way of remembering this problem. Okay, maybe last one. Something just came to my head. So, 35-year-old female. This is a report, okay? The rash on the chest after taking some medication, right? And she go out, she has sunburn. Okay, get some kidney stones, right? And then when you check the lab work, the VVC is less than, it's like 25,000. No, 2,500. Or I would say less than, yeah. less than neutrophil. The neutrophil, oh, I'll give you 250, very low, right? Which of these medication you think is a problem? Which of these medication? Metro, Nadisol. Which one you think? Hello, Purino, you know, time, Kava, Mexican, Silverton, Sulfa, Salazine, or try Mito, Spring, Sulfa, Sulfa, I think it's Sulfa, Metazazole. What do you think is causing the problem? Came into the clinic, you complain after starting taking the medication, small rash on the chest. Um, and then when she go outside, she go outside, she develop a sunburn easily. Um, and then some kidney stone, okay, kidney stones, and then runny nose, some fever, a little bit. When you check the BBC, it's like 25,000. What do you think? And then they give you this option. What medication is causing the problem? Which of this is the problem? Sport learning. Which one do you think? This is a case form. You see, I abbreviated the case and I picked the buzzword. Who is the culprit? Rash on the chest. So Steven Johnson syndrome is suspicious. Sunburn, photosensitivity, kidney stone from some drug causing stone formation, runny nose, and white count agranulocytosis. What medication causes all of this? Key, all this are sulfur drugs. If you want to learn sulfur drugs, I have a video, but this is all are sulfur drug. Metronidazole is a sulfur drug. Allopurinol is a sulfur drug. Phenotime is a sulfur drug. Carbamazepine is a sulfur drug. Silverdin is a sulfur drug. Sulfasalazine is a sulfur drug. Trimethoprim sulfametazole is a sulfur drug. All of these medication may be causing the problem. All should be included. These are all sulfur drugs you should be familiar with, and they can cause all these problems. They are all sulfur drugs, and they can cause this problem. So the patient probably may be taking. So if this is a selected apply, you got to choose all of them. But you don't have to if you don't know them. You just pick those that you're confident. So this, this are all sulfur drugs. So they are sulfur drugs. Take care of yourself. Sport learning, adapting to this way. You guys have a good day. Merry Christmas. Any questions, guys?